Okay, so I'm curious though, because when you say like brain fog or joint pain, things like that, that to someone who has implants, that easily could be that their hormones are off or that they've got some gut issue going on. It could be a plethora of issues, fatigue and the things causing inflammation basically. So how does someone know it's actually the breast implant? Is there a way to test for that bacterial infection or no?
Not before surgery, not currently. So it's one where you need to make sure from a medical standpoint, the patients have had those issues to the best of their ability optimized. Now we have patients come in with a whole, you know, fistful of paperwork from every, doctor they've seen, the GI doctor and the rheumatologist. And, most of the people that come to see me now have went through extensive workups elsewhere. And they're kind of at what they consider the end of their, um, rope with this, you know, problem. So I look at breast implant illness as you just said, a chronic inflammatory process of which implant is playing a role. And you don't know how much or how little of a role that implant is playing, but just if you follow the scientific literature and you look at, basically what's found after explant, there's always typically chronic inflammation found in the tissues around it. And then from a symptom inventory standpoint, our patients, clinically do better. Now we have a pretty aggressive, program when it comes to helping them with toxicity and then helping them, get better through a series of holistic treatments. It's a little bit more complex than, it's quite a bit more complex than somebody just explanting and magically they feel better.